This morning, we will be looking at a major issue in regards to our mental health. It's a program brought to you by Neem Foundation. Neem Foundation has a Neem sanctuary where they deal with issues around mental health. We'll give you a phone number and an email at the end of the conversation today. If you know someone, a family member or friend who needs care, who needs help in regards to mental health issues, please call the number. Now, we have a culture in Nigeria. When we talk about mental health, we relate it to the man who walks around the streets naked. That's not it. Most times you're stressed at work, you work in a toxic environment. The COVID-19 can also have a huge impact on your mental health. I tell you for free. So here's what you do. We'll give you a number to call to go for a checkup. But on the program today, we will be discussing with Dr. John Umogbai. He is a medical doctor, a behavioral and psychological medicine and mental health enthusiast with experience in substance use, addiction medicine, and mental health. He is a technology, business, and animation enthusiast with proficiency in occupational health in developing countries. Dr. John is a clinical lead and SMO at Olive Prime Premium Psychological Services. We'll be talking about addiction, how Nigerian youths have had experiences, the signs, and all of that in a moment.
What's mental health?
He asks all the questions everybody wants to know.
It basically includes our emotional, psychological, and social well-being.
You're driving me half out of my mind, you crazy old coach.
It affects how we think, feel, and act. Oh my God. Not just that, mental health helps to determine how we handle stress, and other things as humans. The Mind Clinic, a platform where people can talk about issues directly or indirectly on mental health.
All right, guess who we have on the show this morning? As usual, every Wednesday, co-host on the Mind Clinic, Chiyogo Densi.
Hello, it's good to be here.
Good morning. I mean, the COVID-19 happened.
Yeah.
And we missed having you live in the studio,
Yeah,
but she's back.
First time back. Feels good.
Glad to have you here.
Thank you.
I did talk about our guest on the show this morning. I told you he is a behavioral and psychological medicine and mental health enthusiast with experience in substance use, addiction medicine, and mental health. He's a technology, business, and animation enthusiast with proficiency in occupational health in developing countries. He is the clinical lead and SMO at Olive Prime Premium Psychological Services. Dr. John Umogbai is our guest on the show. Good morning.
Good morning.
Did I get your surname?
Perfect.
Great. Glad to have you on the show. So we're talking about addiction this morning.
Yeah. So like this month and the entire conversation we're having is around the young people and youth and their mental health.
And can we say it's International Youth Day?
Yes, it actually is.
Yes,
So
the 12th of August.
It kind of actually we are in sync or in spirit. WHO and everybody keeps saying substance abuse is one of the things that affects the young people a lot more, and addiction is one of the problems that we have amongst young people. So we thought we would talk about this topic and even open it up to people to join the conversation and just tell us what they think, their experiences, and ask questions. So we have Dr. John, who's a medical doctor. He works on addiction, and he's the best person to, talk about this with us. So let's get into it. Straight to the point, what is addiction?
Addiction has been perceived in several different lights.
Okay.
But in truth, if we have to speak about it clinically and define it for what it really is, addiction is a chronic relapsing brain disorder characterized by certain key things, and I'll mention them. One, there's craving, right? Apart from craving, there's also loss of control. And then there's what we call tolerance. Tolerance meaning that I've reached a certain level, I'm no more satisfied, I have to increase it to get the same satisfaction I used to get. And the most important thing is, despite knowing the negative consequences of what it's doing to you, you still go ahead to use the same substance or engage in the same habits. So that defines addiction.
And I think I'm glad that you actually mentioned the fact that it's a brain disorder, because a lot of the times people think, once you become addicted, because there's a difference between use, abuse, and addiction. It's like a progression. But once someone gets to a point where they're addicted, it's a lot more difficult for them to just, quote unquote, snap out of it or just stop, because now it's like it's a brain thing where the brain feels like it needs that for your body to survive. So thank you for clearing that. But let's get to some of the specifics. What are some of the addictions that Nigerian youths experience?
In broad terms, there's a chemical addiction and then there's behavioral addiction. Chemical addiction, we're talking about substances from cigarettes to marijuana, different types. They even have several names for it. Arizona, Loud, Colorado, and you hear them talk about it.
This doctor is aware.
Well, that's what I do anyway. Down to Rohypnol, blues as they call it, tramadol, codeine, diazepam, even prescription drugs as well, several different types, morphine. Take that aside, then you now have the behavioral addiction, sex addiction, internet addiction, gaming addiction, several others.
Internet addiction?
Oh, you have no idea.
Oh my goodness.
Yes. There's even a term, Facebook addiction. It's widely talked about now. So several types of addiction. People can be addicted to different things.
And this is linked to mental disorder.
Yeah, especially when pleasure is attached to it. I think I'll just leave it at that for lack of time.
Okay.
Yeah, exactly.
Okay.
Yeah, I'm glad you pointed that out. So let's zero in a bit on substance addiction and substance use and addiction. What are the causes? What causes people to, and then what are the signs of substance use or substance addiction?
Causes. When you say causes, it's varied. I would like to use the term what predisposes one to addiction.
Okay.
Right? So, ranging from genetics. So if you have a family member, close relative, for instance, twin studies have shown that there's pretty much about a 50% chance if your twin is addicted that the other twin would probably fall to it. So yes, family history is a predisposition. Stressors, different kinds of stressors. People cope with different things. Anxiety, depression. So let's group that as mental health disorders. That can result in one having to look for ways to cope with it. And then in a cyclic form, the substance itself can also make one have those conditions. Yeah, so that's about it. Different kinds of stressors. Behavioral stressors, social stressors, family stressors, work, self-esteem, peer pressure. That's a very big factor as well. So you find that I just want to belong, and it starts from there, right? Or a behavior that wants you or tends towards that individual trying to please people. So I just want to please people all the time. Lack of being assertive. These are predisposing factors, as I will call them, and it varies. Stressors can even be mental, psychological stressors, sometimes grief, loss of a loved one, depression, pressures at work, a toxic partner, just call it, and then a need for fun. Some people have, even personality too comes into play. People have different kinds of personality. There's some who are borderline, some are just, some have what we call antisocial personality. This tends towards people who would likely go into substance or engage in risky behavior, so to say, as I like to put it. So yes, as you can see, it's varied, and there are several reasons why people can engage in substance and then in due time transit into what we call substance addiction or substance use disorder, as I rightly put it.
So what are the signs? How do you know that a young person is abusing or is addicted to substance?
Okay, so
and I just need to clarify, when we say substance, we say alcohol and drugs. Some people like to separate it, but let's just put it together as alcohol and drugs. So yes.
Okay, alcohol and drugs, and the day-to-day substance that we know, just beyond alcohol, like I mentioned earlier.
Prescribed and unprescribed.
Yes. So I put it in two ways, from the individual's perspective and from those seeing the individual, right? So as an individual, what are the symptoms I'm looking out for? I had mentioned some earlier, and then I think I'll go over them again. A craving for it, right? A loss of control. So I do not know where to stop. I take alcohol for instance. Nobody wants to get drunk today. Maybe some people do, right?
There's some who are drunk already.
When they are trying to cope with something and you just feel that's the only way to escape from that. But then you don't want to get drunk and you just see that you keep drinking to a point where you get drunk. You've tried to stop several times and then you can't stop. For that individual, that's a sign. It's beginning to affect, also, let's look at it from this other angle, it's beginning to affect an area of my life. There's a misconception. People think that, I'm only addicted when my life has crumbled. And then I'm lying on the streets all drunk, holding the bottle. No, sometimes it may just be an aspect of the individual's life that's been affected. Other aspects may be functional. Work may be functional, but it's affecting relationship at home. It's affecting business. It's affecting relationship with a girlfriend or your significant other. Or it's affecting work itself. Meanwhile, home may be okay. So, significantly affecting a certain area of my life. Then when it's taking time, significant time out of your life as well. 1 hour a day, extending beyond that, you realize that, yes, there's something wrong and I can't do without this. So it means it's taking time. Funds as well, I'm beginning to spend too much on it and then I can't help it. And then you ask how much do you spend on cocaine and people tell you I spend 100k on cocaine in 2 days. I spend 50k a day. Some would even pawn their cars. People have gone as far as pawn their houses. Right? So from the individual's perspective, yes. Now, from other people around the individual, caregivers, friends and all of that, how do you know? Change in behavior. Right? Put it this way, he or she starts sleeping too much. Or he or she can't sleep. Finds it difficult to sleep, staying awake all night, or routines have changed, or the person does not even want to talk about it or denies certain things about it. Meanwhile, it's obvious that this is what you're doing. So there's no acceptance to it. You begin to find paraphernalias around. So you probably find syringes, you find cards for the cocaine powder, you find Rizzlers, that's the wrapping paper for marijuana, or you see a few things around. That will begin to give you an idea, right? Some people begin to engage in habits that they're not known for. Stealing, borrowing things, begging for money, just an increased need for money. What exactly are you doing with this money?
I'll take you on a few things that you mentioned. You talked about, sleeping too much, for instance. For some persons, they might say that it's a good thing because there are some persons who cannot get enough sleep and recommended it's about 6 to 8 hours. And then we have some people who would tell you they take some of this self-induced substance to aid sleep. So to an extent, how would you relate this to this particular conversation, being that it becomes an addiction and it's bad for their mental health?
Very good question, right? If you have a sleep disorder, I believe you're supposed to say professional to handle that. Why self-medicate? Why self-diagnose and self-medicate? And then predisposing you to addiction, being addicted to that substance, right? And I'd mentioned earlier, people use some of these things to cope with certain things. And I had mentioned mental health conditions. Sleep disturbances are in that group as well. They all fall under that category. So why would you do that? It's not advisable. Do not do that. If you have issues with sleep, then go see a therapist. Go see a clinician who would help you. By the time you start using those substances, you now get addicted to it. And the danger is this. Without this, you become dependent on it. And without the substance, you can't sleep, which already is pointing towards addiction. And then the cycle begins. And you know how it ends. And there's something I'll just need to warn. also with symptoms, and sometimes it gets as far as people having psychotic symptoms. So they begin to hear voices, they begin to talk to themselves, they begin to hallucinate. You're smiling.
Yeah, please go on.
They begin to hallucinate, delusions, extreme paranoia. Some would even tell you that, you know what, it started when it's only when I use the substance. It's only when I smoke marijuana. That's when I hear voices. I'm in a heightened state. I am super alert.
Exactly.
Those are already tendencies.
I'm particularly excited about this conversation because the everyday Nigerian right now has a friend or a family member who is perhaps addicted to one of these substances. I tell you for free, both male and female. But there's this issue of disbelief. We come from a very traditional African society where you, as a mother or as a parent sometimes, you perceive these things around your children and you don't want to, how about my child from a Christian home or from, a certain home, and you don't want to believe it. You see the signs, you see the Rizla, you say, and then you ask, and the child lies to you in the first instance and says, oh, it's from a friend. I say, I know that it's not my child. My child can never do a thing like this and all that. That's on the issue of disbelief. On the other hand, I work with a lot of creatives. Right? We meet a lot of artists, we meet a lot of graphic designers, a lot of people in the industry who I think at this time it has become a norm. Permit my language, because it is gradually, it has become a norm to see those who make even, forgive me, not secular music now. I don't want to mention the other gospel music who also depend on some of this. Could be alcohol. Do you understand? And it becomes a huge addiction. There are some producers, right? Producers who make music, talent managers, artists themselves, sometimes athletes, those in sports and all that, who depend largely on some of these substances for them to perform properly. I meet a lot of these artists. We interview them. They have dark shades on almost all the time. Now, indulging further, you find out, they've had something before they came to the studio for an interview, and that's why they had to wear the shades. Some others tell you that they are shy, very shy before they go on stage to perform. They need something to calm their nerves. Some other times before they come for an interview, they are very shy. They need something. They always need something of some sort. And I'm particularly excited we're having this conversation today, International Youth Day. I'd like for you to react to that because it's becoming a way of life for young creatives.
Thank you very much. I'll start with what you called family disbelief, denial. Would they say I did not train my child well? Right? You find, and you're right, we could have three families here, right? Family A has a child who's going through substance abuse or substance use disorder. Family B has, family C has. But family A would not talk to family B about his problem. They will talk to family B about family C's problem. Do you know that family C has a child who has substance use? And family C talks to family B that, do you know that family A has? And the truth is, everybody knows about it, but nobody talks about it. Right? We need to come to terms with the fact that it's a big issue. It's a challenge. It's a problem. It's a community problem right now. It's a societal challenge. And we need to do what's needful. There's no stigma attached. There are no guidelines to parenting. Nobody gets it wrong. Have you seen a template to parenting? And then the child is an individual themselves. So, but they will need help at some point. And you need to take on responsibility as a parent to help, or a caregiver, or an elder one, or even a friend, right? So it's our duty to care for each other, right? Then moving on to creatives. That's a hard one. I had mentioned earlier that people use it to cope. You'll be shocked how many creatives have social anxiety disorder. Right? Chini, you would agree with me. Yeah. A lot of them can speak in public and they feel that, when I am in that state that this substance is giving me, I become more, as we would say on the streets, gingered. It gingers me. Right? It gingers me. It helped me. I can now face the crowd. Without it, I can. But we have seen, I'm not going to mention names, right? But We have seen several artists, even the greats, who have even died as a result of substance use disorder. Sad end. I share my condolences. But we've seen that. We've seen several who, despite all they've made, they end up crashing. They just cannot sustain a life. They can't sustain relationships. They can't even sustain a home. They can't settle down. Right? But here's the thing. What do you use it for? Yeah. What does it do for you? That's an important question we always ask. Oh, it helps me being creative. But before you started the music, before you even realized that music was a calling, you were creative enough to make a decision into going into music. And the substance was not involved at that time. You were creative for the talent to have been recognized. Why do you have to depend on something? Like I had mentioned, there are several tentacles to this. Peer influence, which is a very big factor. Self-esteem, right? The inability to say no. I just want to belong because everybody in that sphere is doing it. I can go to a club and then they're all smoking shisha, and then I would say no. Oh, I will look like I'm the Jew, as it said.
Pressure.
Peer pressure. Right? So there's a lot of this. And if you pretty much talk to them, they really are not happy about it. And they've tried to stop several times and they're unable to. If such a person is listening to this out there, I think you should reach out. Yeah. It's very, very important because you may look successful to every other person out there, but you can sleep at home. You sit and you're hearing voices. You're in a confused state. And then there's a rebound depression that comes with it, or anxiety that even comes with it. After the high comes the low. And then you're sitting down and you're crying in your own space when everybody thinks or imagines that, oh, you're awesome out there. What exactly have you really spoken to them to find out what they are going through internally on their own? If it was that great, why can't they identify with it?
We have another societal problem in regards to addiction again, and which is self-pleasure. All right. I know that there are some persons who will tell you it's a better way of knowing yourself and getting to understand your body of some sort. And it begins with at a teenage age with teenagers, and some get so addicted even up until marriage. Maybe we could touch on that in maybe 30 seconds, and we'll take a break and come back and take calls.
Self-pleasure, and you mentioned teenagers, right? A lot of teenagers go through what we call identity crisis. It's a big, I don't know what I'm supposed to do with life. I don't know what I should become, life decisions. It's so troublesome for them. Who do I associate with? And all of that. Self-pleasure. What gives you pleasure, really? And the good thing is the brain recognizes what we attach pleasures to. And then repeatedly pulls us back to it when we need that pleasure. So I give you $1 million today. You'll be happy, right? You would want that the next time. You'll be excited. And then I take cocaine. That gives me 1,000 times more of that effect and that heightened state. What do you think the brain will recall when you feel down? The brain will point you towards. And then the addiction begins. It's pretty much not a one-day process, right? It takes some time. For some people, it even takes shorter times, and individuals are different. For some people, with just a few takes, they're already going psychotic. For some people, it will take years, but it causes a lot of damage, and we need to be wary about it. And I would like to point this, very important, that yes, there's a lot of crowd and propaganda out there, like shouting. You go online and then you see all the good highs and all of that. Do people really explore the negatives of these substances and what it does to them? I think that's a question I'll leave to people.
Welcome back, but I have a message from... Okay, I'll censor the name because of the content of this message. Says, I have been... Okay, so this person says, I have been into myself. Permit me to use that on radio. I've been into myself since after graduation. We had a conversation with a few friends, and they all they shared their experiences. And at that time, I did not have an experience and decided to try. And since then, for 10 years, every day, I'm just trying, to censor some of the words because it's daytime radio. But basically, it's about masturbation. So, met few friends, and then at the time, the person had not had an experience, till after graduation. And so I was discussing with a few friends, and after that conversation, decided to try for 10 years every day. For someone like this, how can you break the addiction?
He needs help, or she needs help. Because addiction is not just males alone. Females also go through masturbation. That person needs help. I don't believe that in 10 years, there has been several efforts to try and stop, which puts credence to the fact that, yes, that person needs help. See a mental health professional. It's not something I can break down on live radio, and it's not a one-day process. That person would need to go through treatment. So I would advise that person, wherever you are, make contact with a mental health professional, licensed psychologist, a psychiatrist, a behavioral medicine specialist. Just make contact, and then, yes, there is help. There's help.
I think it's quite common amongst most young Nigerians. I've had a couple of people who I've worked with that had the same problem. So I want the person listening to know that you are not like a rare case. It's quite common among lots of young people, and that there is support and help out there. Just reach out to. We're going to share our number at the end of the program. Please do contact us, and we'll be able to support you.
Okay, so this other one is about caffeine, addiction to caffeine. It says, how much caffeine a day is addictive, and how does one withdraw from taking too much coffee that contains caffeine?
So just like I said earlier, people take several quantities and you realize they're dependent on it. I'm not going to put a cap on that. And then when you begin to see that it's affecting certain areas of your life, and then you're dependent on it, and then it's affecting sleep, for instance, some people say, yes, you would need help. How can one break from it? I think I should just go through treatment for addiction, right? Yeah, so there is a rehabilitation process, which involves there's the detox initially, getting the substance out of your system. And I must warn, that is not rehabilitation. Yeah. A lot of people think that's rehabilitation, so I just lock myself up and then I do a test later, it's no more in my system, I'm fine. You go back, I give you a few days. That day exactly they're back to it. So that's not treatment. It's just detoxification. So the rehabilitation process would entail several forms of therapy. Right, psychotherapy. In psychotherapy, you have the cognitive behavioral therapies, art therapy, several types. I don't think I'll go into detail, involving individual therapy sessions, group therapy sessions, right? Support as well.
Family sometimes.
Yeah.
Family therapy comes in very handy.
Very, very handy. And that's why I mentioned support, right? Because the family and the caregiver or those around have to be carried along. Beyond that, there comes a place for medication as well when it's necessary, or if it's indicated. How would withdrawals be dealt with? Sometimes it could be very, very very troublesome. I think if I would like to use the word troublesome. So it ranges from all forms of therapy, down to medication as well. So it's more holistic. I would like to use the word the biopsychosocial approach when it comes to treatment. So there's the individual where medication will come in, treating the major effects and symptoms, right? There's the psychological bit, which would involve all the different forms of therapy, right? Engaging even family. And then there's a social bit, which is very important. What are you going back to? Is there a job that's engaging you? Most people will tell you boredom is a big trigger. So what's engaging you? What are you doing with your time? Family, relationship, work, several other things in the social environment that would have posed a risk for you going back into it. Those things are dealt with. And I would like to say that when it comes to staying sober and when it comes to addiction, it's a lifelong battle. And there's always a chance for relapse. But that doesn't mean it's the end of the world. Right? It just means that you pick yourself back up with the help you have and the resources around you and support.
All right, we need to go now because of our time.
Yes.
And we must thank you very much, Dr. John Umobai, for being a part of the show this morning. Thank you very much.
Thank you very much for having me.
T, I would like to get contact details on how to reach you at the Neem Sanctuary.
All right. So if you'd like to reach us at Neem Sanctuary, the number to call is 0706 062 5054. The number is 0706 062 5054. Remember, this number is just for psychological support. That's all we offer. You can also look us up on Instagram at Neem Sanctuary. That's NEEMSANCTUARY. Neem Sanctuary on Instagram. Send us a DM, send us a message, send us a text, and we will respond immediately.